Hello, a very warm good afternoon to one and all present here. A warm welcome on behalf of the PCO Society of India. Myself, Ruby Sound, who is also a committee member and the co-chair of the uh, Public Awareness Initiative group. Once again, I welcome everyone, the speakers, the audience, to be a part of this successful program which has been running over the last 2 months now. We heard today for a very, very important panel discussion program under an educational program by the PCO Society of India called the Vijeta, which has been supported by Philips. So, friends, we have been doing this to reach out to all the patients, to the girls, young girls, mothers, sisters, students, and all the patients to teach them about what is PCOS. And we have been doing this over a series of programs. Because we know PCOS is a very, very concerning problem which is existing today with the number of cases which is rising. Every 1 in 5 Indian women in the age group, especially in the reproductive age group, is suffering from PCOS today. The reasons could be many, whether it is lifestyle or it could be the kind of a diet or it could be genetic. There are various reasons to it. So to learn and to avoid the complications, it's important, very, very important to learn why does this happen and how you can prevent and how you can manage PCOS. The most challenging concern is its effect on fertility. We see a lot of women undergoing fertility treatment, and especially these are these PCOS women. So it is an effort of this entire PCOS society to talk about PCOS and its effect on fertility and how one can manage with that. And for this, we did an entire season on this subject with different episodes. So far we have done 6 episodes where we discussed about its diagnosis, investigations, how lifestyle management can help women with PCOS, what are the treatments available today, whether it is oral drugs, whether it is ovulation induction, whether it is use of injectable hormones, or if one has to take a assisted reproduction technology as a second line of treatment. We had experts, doctors like Dr. Duru Shah, and with the support of Dr. Shobna Patar, we went through all of these subjects one by one over the last 2 months. Today, we come to the last episode where we are going to discuss more and beyond that. So today with us, we are going to have discussion on dermatology issues. We're going to talk on the psychiatric, mental health issues, and we are also going to talk about the role of exercise in it. So we're going to have a panel discussion with all different experts, and who is going to help us is none other than the expert in this field, Dr. Padma Rekha Gilje. Ma'am doesn't need any introduction. However, for a formal introduction, let me tell you that besides her medical degrees, she also holds a degree, an MBA, and also in medical law and ethics. Ma'am is from Kolhapur. She's a fertility specialist at Shriya Hospital. She's also the founder director of Prismatic Research Foundation. Ma'am is an editor-in-chief of the Journal of Human Reproductive Sciences. She has n number of publications, a huge number of publications in international journals on infertility and especially IVF. As we know that she is also a chairperson of the Special Interest Group of Reproductive Endocrinology. Ma'am, it's an honor for me to have you here, and it's a great privilege that you are going to conduct today's session. I welcome you, ma'am, to today's session and thank you very much for your valuable time. Over to you, madam, who you can take the discussion forward from here.
Thank you, Ruby, for this very kind introduction. And I'm very much looking forward to enlighten everybody participating and do get enlightened with this esteemed panel I have the pleasure of addressing today to address the very pertinent issue of fertility and various aspects related to fertility and PCOS. And when we think of fertility, we are only thinking of reproduction, but directly or indirectly, there are various other issues, multidisciplinary issues we need to think of, be aware of, and also educate our patients and families who are going through this scenario. So to address these very important issues, we have this esteemed panel to start with. Madhuri, a very dear friend, nationally and internationally renowned reproductive endocrinologist. She is a clinical director of Dr. Patil's Fertility and Endoscopy Clinic, Bangalore, Vice President and founder member of PCOS Society of India, President and founder member of Fertility Preservation Society of India, Vice President, Indian Society of Assisted Reproduction, Associate Editor, Fertility and Sterility, which is an official publication of ASRM, the Oncofertility Journal and also of the Oncofertility Journal. She has won Dr. Durusha Lifetime Achievement Award from ISAR 2022 and Vidya Vibhushan Award from ICOG 2021. Member of International Reproductive Medicine Research Network. She has multiple publications in national and international journals and written several chapters and edited several books. Welcome, Madhuri. Next, we also have Dr. Sapna Bangal. She is the head of Empower, the Center, Mumbai, and psychiatrist. She has been awarded membership of Royal College of Psychiatrists in 2009. She has completed certificate of clinical training from UK, certification in child and adolescent psychiatry. She has more than 20 years of clinical experience, which is indeed very vast. Special interest is eating disorders and emotional problems. So she is a perfect person to address all the mental issues associated with PCOS. And she has numerous publications in research journals. Welcome, Sapna. Next. Of course, we have our own Ruby, the one who works really hard for PCOS Society of India and keeps us all in check as far as our eating habits are concerned. She's a co-chair of Special Interest Group on Public Awareness, PCOS Society of India. She's also managing committee member of PCOS Society. She's a consultant dietitian, founder Eatwise Nutrition and Wellness Clinic Mumbai, secretary Indian Dietetic Association Mumbai chapter, and member NSUK and various organizations related to diet and nutrition. She's a certified neuro-linguistic practitioner. Welcome, Ruby. Next. We also have Twisha Parekh. She, in addition to her doctor's degree, she has Masters in Exercise and Sports Medicine from UK, PhD in Sports Medicine, consultant sports physician, HN Reliance Foundation Hospital, Mumbai, Ayush Certified Yoga Instructor, consultant for Indian Super League, many elite athletes and sports academies across India, sports medicine doctor at Ladakh for La Ultra 55, 111, 222, 333 and 555 kilometer runs. Trained at world-renowned centers of sports medicine in South Africa, UK, and USA. Expertise is mainly in promotion and physical activity and healthy lifestyle. So welcome, Twisha, once again to very wonderful interaction this afternoon. Next. And we have Rachna Sampath Kumar, a young dynamic dermatologist from Kolhapur. She is a past president of Kolhapur Dermatologist Association, awarded icon of Maharashtra, West Zone of Sakal News Media, life member of various national and international associations. So I think we are very well equipped to address the various issues associated with PCOS in young population going through infertility. And without any delay, we will move on to address very important issues that concern us and our patients, all that should concern young population with PCOS who is considering fertility. So to start off, Madhuri, I would like to welcome you once again and ask you a very important question. You know, these days, because there is so much of information available about PCOS, we do see increasing number of young girls and women coming with a diagnosis of PCOS. You know, normally when somebody comes to our clinic, we tend to ask what are their concerns, and these days they do say, I have PCOS. So I think, you know, apart from being very clear in diagnosis, it is also important that we do not overdiagnose the condition. So please, highlight what are all the steps that are needed for an appropriate diagnosis of PCOS?
Yeah. So we need to divide our patient groups into two. One is who are adolescents, and the other is the reproductive age group. So this is very, very important, because when it comes to adolescent, we should be very careful in labeling the adolescent girl as PCOS, because we know there are certain features like irregular menstrual cycle as well as the polycystic ovarian morphology, which is seen in the ovaries, is a normal physiological process during puberty and in the post-pubertal age. So we have to wait for at least a minimum period of 8 years post-menarche to establish a diagnosis of PCOS in an adolescent. And here we have to be aware and we have to basically counsel the patient that they should not consider themselves as PCOS, especially many a times patients who have irregular periods and then they also have a PCOS morphology. They think they are PCOS, but we know that PCOS morphology is a part of an adolescent during her pubertal and post-pubertal age. If she has hypoandrogenemia, then probably we should keep it at the back of our mind, because even we know that having acne is a part of the pubertal stage of development. So basically, we should keep in mind that probably if she has all the three features, that is, she has acne, that is signs of hyperandrogenism, she has irregular cycles, and she also has PCOS, polycystic ovarian morphology, then we should just keep in the back of our mind that probably she's at a higher risk of developing polycystic ovarian syndrome, that is the PCOS, and therefore she has to be regularly monitored. And then after 8 years of her menarche, we have to then find if she still has the findings, then probably we have to label her as PCOS. Whereas if we come to the reproductive age group, initially it was thought that we should have at least 2 symptoms out of, that is, presence of excessive male hormones, which may manifest either as hirsutism or as acne, or you could have the balding which is seen, or having menstrual irregularity wherein you have periods coming at 2 or 3 months interval, or you just don't get your periods for 4-5 months, or you can at times also have excessive bleeding and you can have short cycles. So if you have that, and then the third feature, what we basically look at is the presence of polycystic ovarian morphology. So initially it was thought that we should have either 2 out of the 3. But today, the new consensus which has come internationally says that if you just have the presence of hypoandrogenemia, that is, she has hirsutism, acne, and she has irregular cycles, then we really do not need to go and do an ultrasound to diagnose PCOS. But if only one is present and the other is absent, then having to do an ultrasound is very, very important. And the presence of polycystic ovarian morphology will then help us in diagnosing PCOS. We know that PCOS is associated with abnormal glucose tolerance. So probably we need to do an oral glucose tolerance test. We have to also do a lipid profile because that could be abnormal, because metabolic features are the part of polycystic ovarian morphology. There's actually no need to do any insulin levels today. And if she does not have signs and symptoms of clinical hyperandrogenism or excess of male hormone clinically, then probably we need to do biochemical examination, wherein we need to detect excess male hormones in the blood. And the best test to do is a free androgen index, because where we need to just calculate the total testosterone and the sex hormone binding globulin, which will give us the free androgen index. Doing the other androgen levels like free testosterone and all, really, they are very laboratory and time consuming, and there might be fallacies during testing, and therefore should be avoided.
So I think there is a lot of, consensus arising at international level as to how to diagnose. As you have said, somebody having very regular cycles, longer than 35 days, and or having features such as excessive hair growth in certain specific areas of the body, or pimples and certain types of balding or hair loss. All these should raise concern about PCOS, and sometimes we may need the aid of ultrasound to look at the ovaries. And if the diagnosis is confirmed, or if there is any doubt, as you said, we need to look at the testosterone levels. And if the diagnosis is confirmed, as you very importantly said, we need to look at their glucose. We need to do an elaborate study of their glucose tolerance. So I think, so it does require all these steps to come to a conclusion that one individual has PCOS. So nobody should be liberally labeled as having PCOS. So Twisha, once the diagnosis of PCOS is considered, how important how much of importance should we give about stress in preventing PCOS and also in promoting fertility in those diagnosed with PCOS? You're muted.
So because lifestyle management is one of the main cornerstones of PCOS management as well as prevention, that's where exercise comes in as one of the crucial components of lifestyle management. And exercise, the biggest role it plays in PCOS is twofold. One is prevention of obesity and treatment of obesity. So because we know that, of course, there are two categories in PCOS, which is lean and obese PCOS. But because majority is still obese PCOS, so one way exercise helps is by reducing obesity. The second way which it helps is by helping in the insulin resistance, which is a crucial component of PCOS. So exercise impacts muscles. Muscle is the most insulin sensitive organ, which means that the maximum glucose absorption does happen. A lot of glucose absorption happens through the muscle. So because exercise increases the muscle volume, and exercise, even if it doesn't increase muscle volume, like a simple aerobic exercise, even though if it may not increase muscle volume, it still improves the insulin sensitivity of the tissues, which means that the sugar levels will fall, insulin sensitivity, insulin resistance will reduce. So that is the other way it can still benefit the lean PCOS, because that's the question very often we get asked that, if it's lean PCOS, how is exercise going to help that? Because very often a lot of population feels that they need to exercise only to lose weight. But exercise does not have just one advantage. It has many advantages. Weight loss is one of the many advantages, but insulin sensitivity is a very, very profound advantage. So even if they don't get weight loss, they still improve in their other parameters, biochemically and overall. And the final
working at tissue level also. I mean, that is something we need to
correct.
appreciate and not get disheartened if we are not achieving expected level of weight loss. Yeah, I think that's very,
and
very
because
important.
It's a lifestyle management, exercise releases endorphins, which improves your feel good factor.
Oh, that's very, very important. Yeah.
Yeah. So that does generally help in that. So that would be the things for prevention. And as regards fertility is concerned, they have also done studies where they've noticed that when the quality of the eggs, it literally improves even after the person undergoes a period of a systematic exercise, the quality of eggs in PCOS versus, once they've undergone a period of exercise also is improving. So that's the impact that it can have on fertility. And the same thing with lean PCOS fertility as well. So even it's not that in obese people, obviously it's going to help in reduce weight and that will impact fertility. But even in lean PCOS, they have seen that because the quality of eggs is not great, exercise helps improve that.
Wonderful. So I think it's not just the body image or the appearance, but at every level, as you said, it has a mood elevating factor. It improves the tissue sensitivity to insulin, and also it improves the quality of eggs. So it has multitude of beneficial effects.
So basically, Rekha would just like to add that the thin PCOS basically are sarcopenic. Sarcopenic is wherein they have less of muscle.
Correct.
And they have more of abdominal fat. Though they may not be having peripheral fat, they basically have a lot of abdominal fat, which is related to high male hormone levels as well as insulin resistance. Absolutely. And therefore, muscle training, as Trisha very rightly said, is very, very important even in the thin PCOS.
Yeah. So, Ruby, there is always this discussion about what is most important, whether it is the diet, whether it is the exercise. So let us assume for this discussion that both of them are complementary to each other. And if we can incorporate both of them in good measures, it will really benefit most of the people with PCOS. So now concentrating on diet, should it be only for those who are overweight, or across the spectrum, everybody would benefit with healthy diet? And also, is it really necessary that once as clinicians we make a diagnosis of PCOS, irrespective of their weight, should we seek a consultation with a qualified dietitian? How important is that? So please do address these questions.
Thank you so much for such important questions, ma'am. I will begin with the first question. So basically, ma'am, what is the objective of giving a nutrition plan? It is not only weight loss. The main purpose of a nutritional intervention is the management of insulin resistance, whether it is an obese patient or a lean patient. And diet plays a very important role because among whatever food we eat, it is the carbohydrates which we know that we consume as Indians at least 60 to 70%. This is going to increase our blood glucose level. And that is going to increase the amount of insulin produced by the our pancreas, right? So that insulin resistance is one of the underlying causes of hyperandrogenism and other issues of PCOS. So the purpose of giving a diet could be different in lean and PCOS, whether it is to give less calories because you're trying to lose weight, or give the same amount of calories if the patient has to maintain the weight or avoid weight gain. But the main purpose is to ensure that the insulin resistance is under control. So diets which are low in carbohydrates, diets which are low in simple, sugars, or are recommended. Diets low in fat is also recommended. So the focus is only to give healthy carbohydrates, healthy proteins, healthy fats in the diet. So whether it is lean or obese, that is very, very important. Also, like Dr. Tisha and Madhuri ma'am also said, weight loss is very, very pertinent. Even if the patient loses 5 to 7%. Okay, so it's not only the quality of egg, but also the chances of getting pregnant is very, very high in these patients. So weight loss is the primary goal. So diet plays an important role. However, ma'am, let me tell you that if the woman is about 35 or 38, or she's been told to undergo an IU or IVF, okay, that is the time I will not put a patient on a diet plan immediately. The goal is not to lose weight first and then undergo a treatment. If she has to undergo a treatment as a priority, then diet can be a healthy diet plan, not a weight loss diet plan. So it's important for her.
If we actually consider dietary advice right at the diagnosis, I think by the time they reach a stage where they require advanced treatment, they're already on track, and you may not have to work too much to improve their diet.
Weight loss is not a very big concern when the patient is already ready for an IU or IVF treatment.
Yeah, so this has to be something better addressed right at the beginning of the when the diagnosis
comes to a dietitian.
Yeah.
And the second question of yours was, ma'am, if a patient comes to a clinic, okay, do we need to refer a patient for a diet counseling, each and every patient? So I would suggest yes, it's very important because her main goal is to become pregnant. And if she is on a diet plan, whether to lose weight or to manage the weight, then I think all your nutritional requirements are taken care of. Because it's also an inflammatory burn. PCOS itself is an inflammatory one. So the focus of the diet would be to give her foods which are anti-inflammatory, high in bioflavonoids. She'll be able to carry the pregnancy also, and her treatment protocol also will be much, much easier. And the diet will be different. But I think for every patient who walks in, we have to address her insulin resistance and take care of her right from the very beginning.
Yeah, thank you. Now coming to the mental health issues, Dr. Sapna. What are all the common mental health issues associated with PCOS? I always have this question. Is it always, are the mental issues, associated with PCOS are actually because of the disease, or to some extent, is it because of somebody being labeled as PCOS actually initiates this process? How to address this issue?
Thank you, Padma ma'am. I think it's a very important question. As with all mental illnesses, I think, it goes hand in hand, like the biology and the psychosocial aspects go hand in hand. I think the commonest research has well established that anyone with PCOS is 3 to 4 times more likely to suffer from anxiety or depression or stress-related issues. But some of the less commonly spoken about or known facts is that they are also more likely than the general population to have eating disorders, OCD, as well as bipolar. So there is a wide array of mental health issues that are associated with PCOS. It could be genetic. We know there is a biological component, as we've heard so far from all the esteemed panelists, that we are speaking here about insulin resistance. We are speaking about hyperandrogenicity. We also know that sometimes it is associated with decreased levels of serotonin in the brain, which in turn is associated with anxiety, depression, and stress. So we know that there is a biological component, but also a very big component is the psychosocial aspects. Because I think PCOS, as soon as you hear that, you're somebody suffering from PCOS or you have got a diagnosis of PCOS, the picture that comes to your mind is hirsutism. You're looking at weight issues. You're looking at being overweight. You're speaking to a woman about infertility. You're speaking the balding patches, the skin disorders. So all of that, and you put it all together, and the first thing is a sense of hopelessness that comes in. Because especially in the cultural context, we know that infertility is such a big aspect. It actually gives a sense of, self-image is associated with having children in our society. So when you put it like that, there is, we think that it's inevitable that somebody will go through a period of adjustment issues. There are a lot of what if questions that enters one's mind. So sensitively handling the diagnosis, I think, is 50% of the battle won. How you disclose the diagnosis, how you because as we just rightfully heard right at the beginning, that some people just read up about the diagnosis, and there's so much bleakness around that on social media, that when somebody sensitively handles the diagnosis the first time, I think it does make a lot of difference.
Half the battle.
Absolutely.
And one, yeah. So now coming to you, Rachna, while we are all worked up about fertility of an individual, that individual also has her own journey along with her fertility, about her appearance, about all the skin issues, which are very, very visible to everybody else. And herself. So can you please highlight the most common skin issues these young population has to deal with?
Yeah, thank you so much, ma'am. As other experts told, PCOS is equal to sometimes most common things are hirsutism and acne. So we all know hirsutism is nothing but the appearance of unwanted terminal, long and thick hair on unwanted area, or the male pattern area, that is on the face, the chest, the upper back. We have a Ferryman-Galway scale. We have to categorize these hair growth like mild, moderate, and severe, and then accordingly we have to look into it. But hirsutism is definitely the first commonest presentation, and which is really a concern for the person into day-to-day life. Second thing which is commonly seen is acne. Nowadays, all these acnes with PCOS are moderate to severe in presentation. They will be most of the time on the face, sometimes on the trunk also, that is on the upper back and the chest. They will be pustular, painful. They will be nodulocystic also. They will be most of the time recurrent, and that is again a concern for these all young people to get recurrent acne into their day-to-day life, in their college life and all. And more pathetic thing about this acne is they leave behind the scars on the face. So acne is another commonest thing happening with PCOS. And the third common thing which is happening more with the insulin resistance or obese PCOS is acanthosis nigricans. That is the appearance of the darkened and pigmented skin, the thickened skin in the fold areas and the friction areas. And those are nothing but the neck areas, the underarms, the groin, and sometimes even on the fingers called as the pable fingers. Patients think it is like a dirt and they start rubbing it with the towel and all, but no, it enhances, in fact, the acanthosis. Acanthosis is commonly seen again with the obese or the insulin resistant patients more, but that is again a cosmetic concern for that patient. And another common presentation with PCOS today is androgenetic alopecia. We call it as a female pattern hair loss. Patient starts observing the thinning of hair, later on the widening of partition, and lately the visibility of the scalp. Again, there is a scale for that to say it is whether moderate or severe hair fall. But that is again a concern for those patients with a reproductive age more than these adolescent patients. And
so while they're dealing with their fertility issues, they're also going through
yes. And even after the pregnancies in PCOS also, we see the progressive, telogen effluent leading to the androgenetic alopecia even after pregnancy. And nowadays, even all these obese young girls are coming with the skin tags we call as acropordon. This is nothing but the excessive skin growth seen in, again, friction areas like armpits and necks. So these are the commonest presentations nowadays seen in cases of PCOS with the skin manifestations.
Thank you. I think we will have to, be more, quicker in addressing the questions, because there's a huge number of questions coming in from the audience, which is very, very encouraging. Is Madhuri here? I don't see Madhuri. Okay, I had a question for Madhuri. I'll try and address that because it just keeps in with the flow of the discussion. One of the common questions is why young women with PCOS should be concerned about their fertility. I think it's been addressed so far by most of the experts directly or indirectly, because, they have... Okay, Madhuri is connecting. Madhuri?
Yeah, tell me.
Yeah. So I just wanted to know, why should one with PCOS be concerned about her fertility?
Yeah, so basically...
Also said, Madhuri, there are lots of questions, so we will stick to 2 to 3 points for each
so
question.
Basically, the women who have PCOS, they have abnormalities wherein they have abnormal hormonal levels, which includes high levels of LH, AMH, and they also have high levels of male hormones. And all these things put together, they result in anovulation. That is, the follicles in the ovaries do not grow and ovulate. And if there is no ovulation, so there's no oocyte that can be fertilized, and this can result in infertility.
Yeah. Sapna, now, when they're going through their fertility issues, you did mention that they can have a lot of mood issues, eating disorders. Are there any natural support systems they can adapt to and help themselves to deal with these? Or when should they consult an expert?
So I think lifestyle changes, we've all, I think it's very, very important that we follow the lifestyle changes that have been advocated. So simple things like exercising every day, having a healthy diet. We know that Tuesha has already spoken about how that increases the endorphins within our system. So those kind of things are absolutely necessary. But in time, when we notice that, there is a low mood that is consistent, there is lack of motivation. From the doctor's point of view, if there is non-compliance of treatment, for example, we don't realize that it is because of the lack of motivation and hopelessness that is set in. So any consistent lack of mood, low mood, functional when they're not functional, so they give up a lot of things, social isolation sets in, they feel shy or they feel embarrassed to go in social situations. So anything that causes a person to change the personality that they had from before, we should always advise that person to seek out help, because the earlier, before the whole spectrum sets in, if we can address those concerns right at the beginning, the prognosis is that much better.
Yeah, thank you. Ruby, now how, it's easy to motivate somebody to start on a healthy diet, but how do we all adhere to a healthy diet? How do we make it interesting enough for a lifetime to adhere to it? And what is the sequence of eating, we can adapt to? What should we be having first before we have carbs, or to maintain our glucose levels? And how often can we eat in a day?
Okay. I think, let me begin by saying it's easier to change somebody's religion than changing someone's diet. It is that difficult. So adherence is another challenge altogether. Simpler the diet, easier it is to follow. So the patient compliance is possible only if it is very simple in cooking. It is easily available. It is not very expensive, not very complicated. Something that
these days, I think people don't cook. We don't cook. That is also
availability. Yeah. And if you give some fancy foods which are very expensive, 400, 500 rupees a meal, the patient will not be able to adhere. Something which they can get locally at a reasonable price. The point is not to give a diet which is so fancy. The normal eating habits can be slightly modified. For example, you can just change the ingredient of a particular food. Even if you're not cooking, you can order for right foods. So adherence is possible only if you give right. Second thing, If you give them smaller goals, if you tell them to lose 15-20 kgs, they will not be able to adhere because they will not get results. If you get results, smart, measurable goals, like, 1 kg per week, 2 kg, they will follow the diet because they get results. They'll see better, no acne anymore, better skin, no hair fall anymore over a period of time. So these outcomes will encourage them to follow the diet for a long period of time. So coming to your second question, keeping it very short, if you take protein first, suppose typically what we do is we eat a chapati, okay, a morsel of chapati with little bhaji in the dal, carbohydrates. Or in the morning when you wake up, you eat 2 biscuits with a cup of tea. If you change this and include proteins and fat before the carbohydrates, what will happen is it will give you more fullness, good feeling of satiety. So your next meal will be less in calories. And instead of eating 4 chapatis, you will eat a lot of vegetables and little less carbohydrates in the form of chapati or a rice. So the sequence of eating is very important. Carbohydrates come last. Proteins and fiber come in the beginning along with good healthy fats. Also, how many number of meals should one eat? Now, I will not keep it, generalize the statement. Also seeing the insulin pattern of a person. Okay, nowadays you can also measure that, okay, after certain food, how your insulin jumps. Yeah. That is not possible for every patient. But over the period, like how Jainism and other communities follow, 2 waqt ki roti ya 3 waqt ka khana is more than enough. Eating
I think
every
that is
time is going to give an insulin surge.
We're having an insulin spike every time we eat. Many times we think what I'm eating is healthy, so it is good for me. But still it is causing an insulin spike. Yeah. And that is, encouraging more weight.
Yeah, less food, less number of times. As simple as that. That is PCOS diet.
Right. Rachna, while they're pursuing their fertility issues, can our patients, can our young women still take care of their skin? Can they safely deal with their skin issues? And also, what about laser? How safe it is and whether they can use these when they're going through fertility treatment?
Yes, of course, ma'am. When they are going through infertility treatment, they can definitely go with the lasers. It depends, but in our day-to-day practice, we keep infertility treatment topmost. So that's why we say that instead of going with the lasers, presently we'll just go with the topicals in case of acne scars, and the medicines in case of the hirsutism or acanthosis. And after the pregnancy gets over, then we really tell the patient to start with lasers, because lasers are available for acne scars, and hirsutism. Okay. But we always keep in our private practice the pregnancy on the top. So patient will be always concerned about pregnancy. So we say till you are not completing the pregnancy, we can keep the laser on the platform. Instead of beginning with it, we'll just start with the topicals and medicines. That's how we go with in pregnancy.
So is it harmful during pregnancy?
Ma'am, actually it is not harmful, but the cases or the research which was done on the other, the animals and all, it says that it's better not to give all these lasers when the main issue is pregnancy for that particular family.
Yeah. Twisha, one of the concerns, increasing concerns is the screen time for each and every one of us. And we know that it has multitude of negative effects. So how much of a damage does it cause in your efforts to bring down the weight or control the weight of an individual? And please do, elaborate on this.
I think we all know, like you said, the disadvantages of screen time. But as regards a direct correlation with exercise, if the screen time is eating into your exercise time, then it's definitely harmful. If it's eating into your exercise time, your social time, and your sleep time, because all these 3 things are important to reap the entire benefit of exercise. What I mean by this is, of course, if your screen time is cutting down your exercise time by half an hour, you're not getting the benefit of exercise. Yeah. If your screen time is reducing your sleep, that is also not good, because to recover from exercise and to get the full benefit of exercise, your body requires sleep, because during exercise is actually catabolic. When you actually do physical activity, you're actually getting muscle kind of breakdown while you're doing the activity. And actually the building of the muscle happens while you're recovering. So that's why, we try and design the exercise program such that there is a catabolic and there is enough time for anabolic. So if you're not sleeping well, you're not recovering well, you're not eating the correct food, that anabolic phase will not happen. And ultimately, of course, again, the screen time is eating into your social thing, which is going to affect your, psychology and everything like that. Then it is. So there's no directly a disadvantage of, a lot of people use the screen while exercising. Of course, things like yoga will say, things like an exercise form of yogasan will say that, no, you need to be completely into the exercise. But the Western style of exercise doesn't follow that. Yes, we can be watching TV and, treadmills come with TV screens and have people even reading Kindles. So, no, but your muscle is still exercising. So some impact is there, but till the time you're exercising, it should be fine.
Yeah. Madhuri, now coming back to hardcore fertility treatment, sometimes there can be a misconception that women with PCOS, with all the factors we have discussed so far, there may not be many options for them to conceive. So it's very important that they are aware of all the different options available and how, very effective they are. So can you just take us through the multiple options available, and once they achieve pregnancy, how they should continue to take care of themselves?
So though we say that lifestyle modification is the first line of treatment, we need to take into consideration the age of the patient. So if the age of the patient is 37, 38 years and she is obese and then she comes to us for fertility treatment, then we should not say, oh, you reduce your weight and you come after 6 months, because we know that the number of eggs which are present in the ovaries reduce with age, and this reduction is much faster once the patient crosses her age of 36 years. So this is one important factor that we need to remember. Then, as I told you, that the main cause for not conceiving in a PCOS woman is not ovulating. So we need to use drugs which will induce ovulation. So we can divide them into two. One are oral drugs and the other ones are injectable drugs. So the oral drugs are basically given early in the cycle, where they need to be started either on day 2 or 3 of the cycle, and they're given for about 5 days. And then it's important that we do look at the response of these drugs. And this is basically done by monitoring the follicular growth by doing a transvaginal scan. So if she ovulates, we can advise her to go for timed intercourse. If she does not ovulate, then we need to go for other methods of ovulation induction. And this includes giving a combination of oral drugs and injections every day, or you can just give injections every day. And this is the second line of treatment. And people who cannot afford the second line of treatment, that is the injections, or they're staying far and they cannot come for monitoring, then probably laparoscopic punctures of the ovary may help in inducing ovulation. But at times it has been seen that even after that, the woman requires giving some oral drugs. And therefore, again, monitoring whether she's ovulating or not is important. And this is, though it corrects a hormonal imbalance, at times it is not enough to increase the FSH, because there's so many follicles, and thus FSH needs to act on that many follicles, which will help them in growing. And if nothing of this really helps the patient in conceiving, the patient needs to go for IVF. But before we start ovulation induction, it's important that we rule out all other factors which are present. And the first factor what we need to rule out is the presence of male factor. And the second is the presence of any tubal factor. And this can be done by doing just an X-ray, by injecting a dye into the uterus, or it could be done by a laparoscopy. And when we are doing our baseline ultrasound scans, which should be done transvaginally, probably if there's any other pathology either in the uterus, in the ovaries, or the tubes, probably could be identified.
Yeah, I think, Madhuri, it's excellent. You've very well highlighted all the myriad of treatments available and how they need to be individualized. And I think it's good communication between the doctor and the couple going through the treatment, and a good understanding is what actually takes the team through towards success. Thank you. So, Sapna, one of the main concerns with PCOS is weight gain. And in women with PCOS who are having these mental health issues, depression is one of the common factors. So I'd like you to address how depression will complicate addressing of the weight issue, and also how do we deal with depression and on medications during pregnancy.
So as you rightly said, depression itself is associated with, either eating too much or eating too less. So you're not eating healthily is the problem there. And complicate that with a lack of motivation and hopelessness that sets in. You don't stick to any of the diet plans that are made or any of the exercise regime that has been told that you need to follow. And that, in sense, leads to the weight gain that we are talking about, or the lack of the weight loss that is expected in these cases. There is a myth that the antidepressants sometimes are associated with, that all antidepressants are associated with weight gain, which is not the case. We have now, with modern medicine, we have quite a few weight neutral antidepressants that can be used in treatment, and very safe antidepressants that can be used in pregnancy as well. But given the fact that only if it is severe and it cannot be managed by psychosocial, therapies, counseling, mindfulness, all of that, only then we go for, the risk-benefit ratio is calculated, and only then we go for antidepressants during pregnancy. But yes, there are weight neutral and safe antidepressants that can be prescribed during pregnancy.
So it's again, once again, communication between disciplines and good understanding of the patients about what they're taking and how safe they are will actually go a long way to reduce all-round stress, taking care of these women. And we do see these happening in our clinical practice as well. Sort of, that good communication between different specialists and the couple and the family makes a lot of difference to their care. So now, Rachna, there are three things you addressed. One is acne, the other one is hair loss, and also this pigmentation, acanthosis. How do we deal with all this in a group of women who are infertile, and their main concentration is infertility and getting through it, but they're also keen to deal with these issues?
Yeah, ma'am. If we are considering the females during their treatment part of the pregnancy, but it is preconception time, then definitely for acne, we have topical applications. Then we also give for pustular acne oral antibiotics. And of course, there is one molecule which generally we don't give pre-pregnancy time, but it works well. But with the total complete signature and the consent, we give that molecule. Otherwise, every patient nowadays, they know that there will be cosmetic procedures available though the patient is in the treatment part of pregnancy, and those are cryotherapy. They know about peels, that is chemical peels. They know about microdermabrasion. So in case of acne, you can really opt for all these treatments called cryotherapy and peels, and they can go for lasers in pre-pregnancy time, that is preconception time. And in case of acanthosis, there will be a couple of orals available along with topicals. We take help of alpha hydroxy acid applications in various concentrations along with orals. And there again, we take help of the cosmetic therapies like microdermabrasion and peels. Various peels are now available for this platform. And basically counseling is very important for the patients in case of cosmetic procedures. And the third thing is, again, acanthosis nigricans and hirsutism. In preconception time, definitely we will say the patient that with the help of endocrine or gynecologist, we are continuing the medications, and we can definitely take help of the lasers. There are now 3 platforms available for lasers for unwanted hair reduction. I'm saying reduction here because we never say, complete removal. We say it's a reduction and long-term, appearance of this hair reduction phase. In that, we have now diode laser, we have long pulse Nd:ARC laser, and we also have IPL. It's not a laser, but it's a light. And all these can be used on the patients with proper counseling in the preconception time.
Thank you. I think, again, it's something we need to bear in mind as fertility specialists, that while we are dealing with a core issue, there are a lot of things that can be done to improve their overall positive feeling. Now, coming to you, Trisha, you have very well highlighted the benefits of exercise. But what are the practical pointers? How much of an exercise should I do? What kind of exercises would be better? If I have, just 10 minutes on certain days? Can I still make use of that to lose weight? And what all out of these can I carry on through the pregnancy?
Okay, multiple questions. First, some exercise and physical activity is definitely better than being sedentary and no exercise. So even if the person does not have structured time in the day, because nowadays everybody does have very busy schedules, even if they just in bites accumulate, a particular number of steps throughout the day by climbing stairs or whatever, we call that just being physically active. That is also better than not doing, being sedentary. Coming to the structured exercise part of it, depending on, I would say, lean PCOS, obese PCOS, slightly the recommendations can be slightly different. Plus, what are the other risk factors and other medical issues that they have, even orthopedic wise, musculoskeletal wise, because that is a big thing which is often omitted, is the musculoskeletal complaints. But you have to realize the exercise with the muscles, and the person might start an exercise, and if they are having knee pain or shoulder pain, they will not be able to go. I mean, that will be the biggest deterrent, as much as they want to exercise. But so a lot of these factors, that's where an exercise prescription comes in, because it will have to be completely tailor-made. Whole on whole, yes, even if a person has 10 minutes, some exercise can be done. High intensity exercise can be done, but again, it has to be tailor-made, because if a person who is not used to exercise goes and does high intensity exercise, they are at risk of everything from a cardiac, from a heart attack to a knee joint pain or some other complaint. So it has to be tailor-made. Whole on whole, aerobic exercise like walking, running, cycling, jogging, swimming, plus resistance exercise, which is weight training, is definitely recommended. Like Madhuri ma'am had said, the sarcopenic individuals, the lean PCOS, 100% should focus on the weight training. So for example, if the lean PCOS only has half an hour, I would rather give them resistance training and tell them, okay, maybe you can do physical activity like jogging, cycling, just walk to the train station kind of a thing, but focus on the resistance activity. For the obese, it will be a combination of both. They have to do both aerobic as well as resistance. So whole on whole, individual treatment, individual prescription, but aerobic resistance combination, things like yoga, breathing exercises, all definitely help because they add to the whole gamut of it. And one thing, what I always tell people, if they ask you, is Zumba better or aerobics better? I know those kind of questions. Whatever you can do regularly is the best exercise, because if you're going to do it for 1 month and then stop, it's not going to be beneficial. If you're going to do it only once a week, less chances it's going to be beneficial. So if you have something you can do at your home, but it can happen 5 days a week, please do that, rather than you wanting to go somewhere or you finding it difficult to go to the gym because it is far away and you can go only twice a week. No. Rather do something which is at 80%, but you are managing to do it every day.
More often.
But it will still have to be prescribed because it still has to be effective. Exercise is medicine, so no point in taking an underdose and it not being effective. So it still has to be effective, but something can literally be done in the 4 walls of the house as well. It's absolutely possible to do it.
And many of these can be continued through the pregnancy. Again, that needs to be revised.
It will have to be revised. It will have to be revised because the kind of risk factors that come in during pregnancy, what else is happening during pregnancy, also because this is going to be a special baby, because they are coming out of an infertility. I would say besides the doctor telling, we have to always consider the whole social circle around the family, around the lady, because, there will be a lot of people encouraging her and discouraging her, especially discouraging because they will feel, please protect this baby as much as you can. So a lot of factors will come in during that.
It is important to take the necessary advice, but continue with some form of safe exercise at that stage. Yeah.
Because that helps. Most of these females will end up with some kind of gestational diabetes. So from the gestational diabetes point of view, exercise is necessary to control that sugars as well.
Thank you. I think the last of the questions I have on my mind goes to Ruby. So how do we incorporate, there is a lot of discussion about low glycemic index food. What are these and which are the common ones in our day-to-day food, and how do we incorporate them sensibly into our diet And also, many of these women with PCOS are on metformin. Do they have any special nutritional supplementation needed?
So, ma'am, I will answer the second question first. Okay, about the deficiencies.
Metformin.
Yeah, because of the deficiencies due to metformin. So, studies have shown that, due to long-term consumption, especially those who are more than 1,000 or 1,500 milligrams of metformin, whether she's PCOS or diabetes, which is an insulin sensitizer, these patients are often seen to be having vitamin B12 deficiency. Because of the drug and its effect on the gut also, because B12 is usually synthesized in the gut of an individual. So all these patients are usually given a supplementation of vitamin B12. So this is what we need to consider for every patient who's put on metformin for a long period of time. This is answer to your second question. Coming back to your first question about low glycemic index. Because when we're talking of carbohydrates, which are going to increase your insulin and blood glucose levels, we want to give food which are not going to increase the blood glucose immediately after eating. For example, if you consume a teaspoon of sugar, going to increase the blood sugars immediately. This is what we don't want in any PCOS patient. We want the response to be blunted or, take a longer time. So how do we incorporate? So don't have to really search for foods which are low in glycemic, but just understand fruits which are lesser sweet, okay, which have less sugar content or less fructose in it, which are going to have a lesser, it will take more time to get assimilated in the body. So select foods which are less sweet, especially the fruits, even mangoes nowadays, which are very, very sweet, very ripe. Okay, more the ripe the fruit is, more sweeter it is, and more quickly it's going to increase the sugar level. So fruits like guava, peru, which we call it as, okay, even the dragon fruit, which is not very sweet. Fruits which are not very sweet are low in glycemic index. Secondly, if you make a juice, it's going to rise sugars quickly. So eating a fruit will, with the skin, especially like an apple or a pear with the skin, is low glycemic index. Second way of changing the glycemic index is, suppose a person is consuming white rice for some reason, it's a gluten sensitive or whatever. If you eat with vegetables, add 1 teaspoon of ghee in it and combine it with some dal, which is fiber. So adding fiber and protein to the carbohydrates is going to reduce the glycemic index. So about white rice खा सकते हैं, provided you're adding extra fiber and protein to it. Idli, suppose, is being made. Okay, so instead of eating idli which is made out of white rice, one can add 1 or 2 tablespoons of oats in that idli batter which you make, which will reduce the glycemic index. Adding some vegetables will do that. Eating a poha or upma is possible by adding some vegetables to it. Simply remember, any food which has fiber, which has protein, okay, and which has some amount of healthy fats will reduce. For example, poha upma. If you add some peanuts, like traditionally Maharashtrians eat, kande pohe with some peanuts in it, is a good option because that fat, which is healthy fat, which is present in peanut, will reduce the glycemic index. So making sure whatever you're eating, you're adding protein and fiber. That is the secret of low glycemic index foods.
Yeah, I think now there is going to be rapid fire. These are the questions from the audience. So we need to take them fast and furiously. So here is somebody who has been diagnosed with PCOS for the past 9 years. So will exercise be able to improve the quality of X even after so many years post-diagnosis? Trisha?
Honestly, I wouldn't be able to comment on that.
Madhuri?
Yeah.
I think it will make a difference.
Overall, exercise will definitely help with PCOS.
Don't dedicate X number of months for exercising and losing weight. But if you continue parallelly with treatment, do you agree, Madhuri? It should help.
It should help because basically it's going to reduce the insulin resistance and also the hyperandrogenemia, and therefore it will improve the milieu in which the eggs are growing. So it has been seen that in patients who have very high levels of the male hormones are also present in the follicular fluid where the egg is present, and therefore reducing all these things would help in improving the egg quality, and along with that probably a proper nutrition along with certain drugs like the mitochondrial which will help the mitochondrial function, as well as the antioxidants will help.
Ruby, any dietary supplement which can help egg quality?
So, of course, any dietary supplement which is loaded with antioxidants. Okay, now inositol is one of the supplements.
I think, that is all, natural whey proteins.
So, when we talk of supplements, then I think, inositol along with the protein supplement has been shown to,
I think they mean basically in our natural diet, probably.
If we're talking about natural diet, then of course, like you said, protein, fiber, and a lot of antioxidants like vitamin C, vitamin D, which is very, in light now. Your coenzyme Q10 is also very important. So a lot of antioxidants in your diet and dietary supplements will help improving the egg quality.
Does PCOS happen to make you forgetful? Sapna, do you want to take that?
It could be secondarily associated with, stress or anxiety or depression. But per se, I think, we have to look for other factors rather than just PCOS and forgetfulness together.
Yeah. Rachna, is acanthosis nigricans treatable, or do we have to live with it throughout our life? And is hirsutism reversible too?
Yes, of course. Both are, treatable. And acanthosis, of course, sometimes if associated with obesity, once you reduce also, sometimes it's itself without treatment also. But acanthosis and hirsutism are both are treatable conditions today with the help of a lot of devices, definitely. But only thing is you have to maintain it, whatever stage we have given to the patient.
Is there any natural mechanism through which we can take care of acanthosis?
As I told before, if the patient is obese, sometimes even the reduction of the weight will reduce the acanthosis itself. And the lean PCOS hardly show the acanthosis. Other than that, definitely taking vitamin C in the diet. Nowadays, they say that it will reduce this hyperkeratosis of the skin.
Okay. Twisha, certain exercises can also amp up testosterone levels and stress hormones, like weight training. Are there any particular exercises that one should do to gain the benefits which you mentioned?
Resistance training, yes, is definitely a thing that should be included. And depending on, if we are talking about stress hormones, so depending on the kind of personality that the person is, I would modify that bit to include, so to decide versus resistance training or something like a yogasan. So yogasans are parasympathetic stimulating, whereas traditional Western exercise is sympathetic stimulating. So if this question by the person is typically targeting that, I would do that. So yogasans is parasympathetic stimulating, so it actually brings down the stress hormones. But normal exercise resistance training will help build the muscle in a much better way.
So there's one question which says, what is the natural way of reducing the PCOS? I think, it's the association between the genetic predisposition and the lifestyle factors. So we deal with our lifestyle factors. I think everyone, each one of the panelists would agree with that. So genetics, we probably can't do much, but lifestyle factors, being less sedentary, more careful about our diet and deal with our stress. So I think these are the ways which we can reduce the incidence of PCOS. How can sickle cell trait affect PCOS treatment, be it with respect to lifestyle changes or oral medications? Madhuri, any inputs on that?
I know the sickle cell anemia is associated with decreased ovarian reserve. But in women with PCOS, usually they don't have much of a problem of ovarian reserve. But probably because it can reduce the ovarian reserve, so probably treatment early in their reproductive age would be more beneficial in these patients who have sickle cell.
And I think none of the medications used have any negative effect, because, just to prevent thrombosis, embolic episodes, I think good hydration and maintaining the lowest level of estrogen possible. I think beyond that, no specific care. Can heavy aerobic or resistance training exercise contribute to irregular menses or ovulation? Twisha?
Yeah, that's called as functional hypothalamic amenorrhea, which happens in people who exercise too much without taking in the enough number of calories to combat that. So only that will not happen. But what happens is it's called relative energy deficiency syndrome. So there's a mismatch of the intake versus the output. So that's when there is a signal which is sent on the hypothalamic pituitary. So basically at a higher level, signals are sent to kind of conserve energy, and ovulation doesn't happen. So this can happen, and the treatment is kind of multidisciplinary again, because you have to control the amount of exercise or manage the exercise by supplementing it with enough food. And a lot of people who face this kind of issues, they often have some kind of eating disorder as well, because they want to maintain their weight, and that's why they're training so much. So that can happen. We see that often in athletes. But that doesn't mean you should not exercise, because exercise still has its advantages. So you just need consultation to manage the situation properly.
Thank you, Trisha. I think, we have had a very, very useful, meaningful discussion with each one of the experts contributing immensely to improve the knowledge towards addressing this ever-increasing problem of PCOS. And thanks to the audience for asking so many pertinent questions. We're all very grateful and indebted. And I think I would like to hand over the further proceedings to Vinita.
Holistic approach of PCOS treatment with a multidisciplinary team. Wow. What an insightful and informative discussion this was. Truly cleared up so many misconceptions on PCOS that we had over these years. Hi, I'm Vinita Mulchandani, and on behalf of the PCOS Society and Vijayata, the winner, I would like to extend a vote of thanks. We had an array of doctors from all over India who had answered all these questions. I would like to take this opportunity to thank the panelists, starting with Dr. Padmarekha Jirge, who is a moderator and also is a gynecologist from Kolhapur. Dr. Madhuri Patil, gynecologist, infertility specialist from Bangalore, also the founder, vice president of the PCOS Society. Dr. Sapna Bangar, psychiatrist from Mumbai. Dr. Prisha Parekh, exercise, sports, medicine physician, also from Mumbai. Ms. Ruby Sound, who's a dietitian from Mumbai. Dr. Rachna Kumar, the dermatologist from Kolhapur. A very special thank you to Dr. Shobna Patat from Belgaum, who is the chair of the Special Interest Group. And most of all to Dr. Durusha, without whom this program and movement would not be possible. I would be grateful to Philips for their kind support. And last but not the least, to our entire IT team of Webstream Communications, especially Mr. Melroy Alfonso, who did a great job supporting this entire episode. A big round of applause to the entire audience for their active participation. And oh my God, so many questions. I'm sure everybody has got their answers from these lovely array of doctors who've actually addressed it so beautifully. We will also be conducting, many such sessions. We have PCOS and pregnancy coming up, adolescents, PCOS midlife and health and beyond, PCOS exercises and nutrition, and all our live videos, including this one, is going to be up on our YouTube videos. So please log into the YouTube channel of PCOS Society and you'll find us there. This will also be there on our website. You can follow us on Facebook, Instagram, Twitter, LinkedIn under the PCOS Society banner, and you will find us there. Everything is available. Of course, if there's anything you'll want to reach out to, you can send me a mail or and let me know if there's anything. Manager.vijayata.pcos@gmail.com is my email address. And thank you so much, everyone, once again for all the help.